first thing a woman should do if she has diabetes and she's contemplating becoming pregnant is to choose her physicians. Because actually, if she has diabetes and she's going to become pregnant, she really has to trust her physician, and she has to know that somebody knows the difference between type 1 diabetes and type 2 diabetes. If type 1 diabetic women are treated just like type 2 diabetic women or gestational diabetic women, the obstetrician doesn't know that what's so bad about having a big baby. The endocrinologist doesn't know how to normalize the blood glucose or the goal. The second thing she needs to do is to do an internet search and read like crazy so she knows more than her physician knows. And she needs to choose the right therapy for herself. She needs to achieve the best glucose control possible, and she also has to know there's no such thing as an accident, and she should know that she has choices. She has choices because having a beautiful baby is a miracle, and it's not easy, and therefore she needs to find guidance from people who really side with her and know that she could start over if that's what she wants to do. So the first thing she needs to do is find a healthcare team who listens to her. Because if they don't listen, how could they possibly be the best caretakers? She also has to be able to argue with them. No, I don't want to be delivered early. Just because I have diabetes and pregnancy and I'm taking insulin is not a reason you have to deliver me early. My baby is normal, and send me for the right tests to prove to you that my baby is normal. And therefore, my baby has a ticket to go to term. That my baby doesn't get a second disease, which of course is prematurity. Less than 6. An optimal A1C is less than 6 because you can therefore normalize the risk for having a missed abortion, a spontaneous abortion, a birth defect in your baby, and have the baby not overgrow and be too fat, and therefore develop obesity because the A1C was too high, 5%. You do it gently and slowly so that there aren't complications associated with, oh my God, I'm pregnant, my A1C is elevated, and yes, I want to keep the baby, and therefore you end up finding out that you're really over-insulinizing, under-insulinizing, over-insulinizing. As an emergency, try to bring the A1C down. But you've got to set your own goal for yourself. And it's not as though if you're having trouble, then find out someone who can help you do it in a safer fashion. Worry about making sure women with diabetes have to worry about having a blood sugar too low. Because indeed, it's not good for the mother or the baby if the mother has a seizure or the mother gets in a car accident. So the first thing the mother has to know is that she can't drive if her blood sugar is less than 90. Because of course if she's not driving and she's home, who cares that she gets down to 40 or 50? She can always go to the refrigerator, she can always treat herself, but she can't get in the car if her blood sugar is less than 90. Because what if she's stuck in traffic, and what if she can't reach or she has a distraction, and hypoglycemia is very difficult to step on the brake pedal. You get distracted and you can't quite find it. You get a little concerned, and yes, the traffic may be awful. She always has to have food in the car, but she's not allowed to even get in the car if her blood sugar is less than 90. It's the best advice I can give a woman once she's pregnant. And then she needs to realize she needs to decrease her carbohydrate intake. There's no way insulins are developed yet to allow for a woman to eat carbohydrates. So she needs to take her multivitamins, and she has to realize that her strategies to keep her blood sugar after eating the postprandial in the best possible range is if she restricts carbohydrate. My answer to that is that I don't recommend a meal plan. I just tell them what not to eat. And what not to eat, they all know classically foods with concentrated glucose. But they're not allowed to eat the big five: bread, rice, tortillas, pasta, and cereal. None of the big five. If they don't eat any of the big five, anything white, they're allowed to eat as much protein as they want. So I don't tell them what to eat, I tell them what not to eat. And as long as they're taking their multivitamins, it's not as though they're going to get vitamin deprived, because I don't let them have oranges or I don't let them have watermelon. I'm not depriving them, I'm just telling them to take out the big five. Don't eat the big five, and yes, eat as much protein as you can. I let my women decide for themselves, and certainly we've shown that multiple injections can have the same outcome of pregnancy as using an insulin pump. The continuous glucose sensor may not be accurate enough. There is not enough science to show the safety and efficacy of continuous glucose sensor instead of doing millions of finger sticks. So yes, wearing the sensor is good advice, but they can't stop doing their finger sticks and they have to keep recalibrating their sensor. And then the biggest question is, where do you put the needle? So as your tummy gets bigger and bigger and bigger, where to move the sensor? So the truth is, it doesn't matter. The baby only sees glucose. And as long as the glucose is normal, the baby will be normal.